Okay, hi, I'm Jericha,
I'm Sophia.
I'm Diana.
and our community group project is presenting to PA students the link between oral and systemic health. Okay. So our target population were PA students. We chose PA students because they have a similar curriculum. They also have a better understanding of medical terminology, which will be useful in their careers with patients. And then the topic that we presented on, again, was the link between oral and systemic health. This is a picture of most of the PA students that were in our group. It was really cool because the one in the middle, Netta, is me and Sophia's close friend. So it was kind of easy with communication that way. So our assessment, the PA students curriculum briefly teaches about oral health. It's not really like a main part of their curriculum. So, any like CE course that they could get on it would be useful. So students may struggle or feel uncomfortable talking to their patients about oral hygiene, just because, if they don't know a lot about it and like proper oral hygiene instructions, they can't really communicate to their patients about that. So that's what we're for. So we did a pre-test that included questions about oral hygiene instructions, the link between oral health and diabetes, periodontitis, and adverse pregnancy outcomes. The results of the pre-test, we'll go into it more in depth later on in this PowerPoint, but the results of their pre-test showed an average of 53% understanding before the presentation. So diagnosis, the target population, PA students, needs education on the link between oral and systemic health. So we must start with education on periodontal disease to begin with, because, if you don't know what it is, you can't really understand the rest. So the first thing that we wanted to teach was what periodontal disease is and what are the signs. Once they understand that, then we can educate on the link between oral and systemic disease, and then we broke it down into 3 categories. So we did periodontitis and type 2 diabetes, periodontitis and cardiovascular disease, and periodontitis and adverse pregnancy outcomes. And then this is one of the graphs that we showed in our presentation, just kind of like the different bacteria that cause different systemic health problems.
Okay, so for planning, we had to schedule a time that worked for both us and the PA students. We're both in a full-time, rigorous academic program, so we opted for a weekday afternoon. Me, Jericha, and Diana met a couple times a month to discuss our presentation and rehearse so we looked competent, that we knew what we were talking about. We had to gather materials, so oral hygiene aids, creating our PowerPoint, getting snacks, goodies, and wine to keep, we kind of had to bribe them with snacks and goodies so that they'd sit through our presentation. And then we had to create a pre and post quiz to assess the target population's understanding and to assess what they learned from our presentation. So for the implementation, it went great. We went to their house. Five of them all lived together, and they got a couple more to come by as well for the presentation. We presented in their living room on their TV with an HDMI cord and our laptop. The presentation was smooth because we practiced many times, and the students were receptive and they learned a lot, or at least they're good at looking like they were being receptive. And their test scores showed that they were receptive. So for the statistical analysis, the dependent variables were the high IQ of medical terminology and understanding of systemic health. The independent variables was the PowerPoint and the hands-on activities, and the extraneous variables were the PA students' fatigue from a hard week of learning and distraction with oral hygiene.
You can kind of hear it too throughout the presentation.
So originally we were planning to present to nursing students from the Lake Washington Tech program, but because we weren't able to coordinate with the head of the program, we just weren't able to present to that population, so we had to present to PA students instead. And luckily, Sophia and Jericha are friends with a lot of the students from the PA program. So it was nice because a lot of their curriculum is similar. So it was easy to kind of switch over between the two. And so in the future, we want to actually schedule a time when the PA students are more rested. So maybe like on a weekend or early on in the day, because when we presented, it was late in, like it was in the evening. And we were tired, they were tired, so they weren't there 100%. Also, the visual aids that we laid out were also a little distracting, and maybe we could have put them out or maybe covered the visual aids before, while doing our presentation, so it would be less of a distraction. For the summative evaluation, the pre-test results and the post-test results, they differed significantly. For the pre-test results, out of 16 questions that were asked, the mean score was 8.4, median was 9, and the mode was 9. And after presenting, we passed out the post-test for them to fill out, and the scores increased significantly. The mean was 15.5, the median was 16, and the mode was 16. So that means, so before like presenting to our target population, 8.4 is about equal to about like 53% comprehension on the subject that we talked about. And then after our presentation, we found that the increase in knowledge was a lot higher, and a lot of them scored an average of 98%, which means that it increased by 54%, which is really good.
All right, so that is it for our project. It was a lot of fun. Sad we didn't get to present in person like our bigs did, but this is fun too. So yeah, thank you for taking the time to listen to this, and we will see you guys in April. Bye.